Now, we are going to talk about, first of all, Weber's test. In Weber's test, what you really do? Yeah, in Weber's test, of course, first of all, you must have a tuning fork. And you should get it vibrating. Then where you put the base of the tuning fork? At the top. For me, you can put it on buttocks, but if someone has a lot of hair, you can put it here. Anyway, let's suppose you put it here. Now, it is a vibrating tuning fork. Right? Now, actually what really happens, when vibrations of the tuning fork are producing sound, these are passing through the bones from both sides. They are passing through the bones and they will come to the ear and directly stimulate sounds through the bone. They will stimulate the apparatus on both sides and action potential will start in both cochlear systems. Is that right? So you will hear as if you are hearing this tuning fork from, if your ears are absolutely normal, you will hear as if you are hearing this tuning fork from both ears, and you will hear from both sides equal. If you are having absolutely normal system, you are producing a vibrating tuning fork here, it will be heard on both sides equally. So we say normally, because sound conduction on this side and this side is same and sensory neural system is also healthy on both sides and working equally good, so we say sound will be equally heard on both sides, so there is no lateralization. There is no lateralization. But if there is conductive deafness on one side, let's suppose there is conductive deafness here, right, and there is no conductive deafness on this side, now one ear will hear more. Which side will hear more? Conductive deafness. Why? Because you can right now do the experiment. Look, you close the triggers, close one side of the ear right now and talk to yourself. You will find that you can do that and confirm it. Close and say anything to yourself. You see, you hear loud on that side. You know why? Because environmental noise is cut off. So bone conduction from here and here is equal still, but because there is conductive deafness, so air conduction is blocked from here, so distractions are lost, so this lateralizes on this side. Is that right? So what really happens, that if there is conductive deafness in one ear, then sound will lateralize on that side. And let's suppose if there is sensory neural deafness in other ear, there is another patient. First we come to the normal person. First person is normal, it will lateralize to which side? None of the side, he will equally hear on both sides. Then second patient come, he has conductive deafness on the right side, so it will lateralize on the right side. Third patient come, he has sensory neural deafness on the left side, neuronal system on the left side is not working. This time it will lateralize on, still on the right side. So it means, listen carefully, that in Weber's test, it lateralizes towards the ear with conductive deafness, or it lateralizes away from the ear with sensory neural deafness. This is the basic principle. In Weber's test, it lateralizes to the, yes, which ear? Ear with the conductive deafness, or away from the ear with sensory neural deafness. It means that if right now you do Weber's on me and it is lateralizing on this side, it means either right ear is having conductive problem or left ear is having sensory neural. How you will confirm that? The test is Rinnes test. Test is Rinnes test. In Rinnes test, what happen, that you will take the tuning fork, get it vibrating. First you put it on the patient's mastoid and ask the patient supposed to give a signal when he stop hearing. For example, I'm hearing it, as soon as vibration with the time become less, as soon as I stop hearing it, I raise my finger. You immediately remove from here and bring the prongs near my ear. If my ear is normal, or if my ears are conducting well through the air, then air conduction should be longer than bone conduction. So it means then tuning fork, when it was vibrating here, when it stopped vibrating on the bone conduction, right, bring it here, person should hear. If person hears, it means air conduction is more than bone conduction. This is normal. This is normal, right? Normally, you people should have Weber not lateralizing to any side, and you should have Rinnes test in such a way that air conduction should be longer than bone conduction. This is normal. Now you see, if your conductive deafness, let's suppose you block this. Number one, Weber will lateralize to this side, and number two, when you will do Rinnes test, right, you will keep on hearing from here. As soon as you stop hearing from the mastoid, you stop it, bring it here. Will you hear? No. So what it really happens here? Bone conduction was longer than air conduction. It means air conduction is not going through conductive process. It means there is conductive deafness in this area. Is that right? Now let's sum it up. Number one, your first person come, you do the Weber, it does not lateralize. You do the Rinnes on both sides, air conduction is longer than the bone conduction. What are the commands? Not normal person, normal ears. Maybe he has a gunshot injury here, right? Normal ear, acha. Is that clear? Number one. No conductive deafness, no sensory neural deafness. Now second person come. He lateralizes the Weber on right side. Is that right? Now what you do? You do Rinnes. In that case, on right side, air conduction is less than the bone conduction. It means he is having conductive deafness on this side. Now another patient come. Again Weber lateralizes on this side. Now he has either conductive problem here or sensory neural here. What you do? You do bone conduction and air conduction. He has air conduction longer than bone conduction. It means there is no conductive deafness here. What should be diagnosed? Sensory neural on opposite side. Is that clear? And last test is Schwabeck test, in which you compare the patient's and your own hearing by the air conduction. Tuning fork test. That is not that important. You should have more clear concept about the Webers, and you should have more clear concept about the Rinnes. Let me repeat it again. Normal person, does the Weber lateralizes? No. But if a person has, suppose right side lateralization of Weber's, it means there is conductive deafness on right side or sensory neural deafness on the left side. If he has conductive deafness on right side, he will have less air conduction and more bone conduction on right side. And if he has right side perfectly okay, but lateralization on right side and left side has sensory neural deafness, then what will happen? He will have air conduction more on the right side than the bone conduction on right side. Is that okay?